Hi everyone, I'm Dr. Anisa Kapadia and I practice rheumatology in Mumbai. This is a short informative video about ankylosing spondylitis, and it also shows us some easy exercises which can be practiced at home. What is ankylosing spondylitis? This is also known as axial or peripheral spondyloarthritis. This is a chronic inflammatory condition which most commonly affects the lower back. Patients often experience pain and stiffness in the back, but also other joints. Sometimes the eye can get involved and patients may have redness and pain in the eye. Other symptoms such as fatigue, tiredness, and heel pain are often present. So what happens in patients with AS? As we can see in this slide, that in a patient who has a normal spine, the movement and mobility of the spine is well preserved. As patients develop early ankylosing spondylitis or AS, there is inflammation within the spine. This inflammation, as it progresses, causes fusion of the vertebrae and therefore reduces the mobility of the spine. This, however, happens over many years and progresses slowly. So who can get AS? Most commonly, AS does occur in males in their early 20s or 30s. However, women can also be affected. In fact, AS in women is often undiagnosed. Lower back pain is a very common symptom and it is often ignored or managed with over-the-counter painkillers. Familial trends or family history of back pain is extremely important. Often, patients give history of their fathers or brothers also being affected. This is an uncommon condition but is still widely prevalent in our society. Many times it goes undetected and patients present at much later stages with a reduction of their mobility, and at that time not much can be done. A history of psoriasis or uveitis, that is redness in the eye, is extremely important. So how can this be diagnosed? The history or the patient's story is the most important thing. A back pain that has been present for more than 3 months, which worsens after rest and especially in early hours of the morning, is significant. Followed by that, a thorough clinical examination is extremely important. After this, your doctor may choose to do an X-ray of your spine or very occasionally an MRI. Blood tests also help, although they are not diagnostic. Some other tests may sometimes be required. So what are the treatment options for AS? Maintaining a healthy lifestyle is the most important factor. Incorporating an exercise regime that is consistent is also important. This may be anything such as swimming, playing sports, or gymming. Should be done regularly. If there are any addictions such as smoking, this should be stopped. For temporary relief, non-steroidal anti-inflammatory drugs or painkillers may be prescribed unless there are any contraindications to these. Drugs known as immunomodulators or disease-modifying drugs may be indicated depending on your condition. There are newer medicines available which can improve the outcome of AS. These should be discussed with your doctor. The most important thing, however, is to not lose hope. In 2020, there are a lot of treatment options and they can help change the course of the disease. In the midst of this COVID-19 pandemic, I know that we are all going through a lot of difficulties, especially patients who have arthritis and ankylosing spondylitis are finding it difficult to maintain their exercise regimes. We have made a small video with the help of Dr. Murtuza Rangwala, who is a consulting physiotherapist, and he will now show us how certain basic exercises can be done in the comfort of your own home. It is important to remember your own limits and not overdo anything which you feel is uncomfortable.
Hello friends, my name is Dr. Rangwala. I am a consulting physiotherapist practicing since last 17 years. Today I will be showing you certain exercises for ankylosing spondylitis patients. First exercise, take one leg towards your chest, hold it 1, 2, 3, 4, 5 and then slowly go down. Then on the other side, take one leg towards your chest and take it towards you. 1, 2, 3, 4, 5 down. Certain people prefer taking the leg, holding the knees from here and taking it there. But sometimes the patients who have knee issues find it tougher. So I prefer it doing from here. Now once you are comfortable doing this, then the other leg can go straight and then you can pull it towards you. This is the next point you can start doing it. Now take both the legs towards your stomach, hold it 1, 2, 3, 4, 5, slowly go down. Again take both the legs towards your stomach, hold it 1, 2, 3, 4, 5, slowly go down. Okay, now the next one is keep both the legs together, keep your hands here and slowly twist. Do whatever you can, don't try to do too much at one go, slowly go on this side, hold it 1, 2, 3, 4, 5, come to the center. Now go on the opposite side, slowly 1, 2, 3, 4, 5, come in the center. Do whatever your body permits you to do. Okay, now one more is the bridge exercise. Keep your legs apart, hands down and slowly lift your back and buttocks up. Hold it 1, 2, 3, 4, 5 down. Once more, slowly lift your back and buttocks up. 1, 2, 3, 4, 5 down. Okay. I'll show you one more today. Clasp your hands and slowly try to go up. Do whatever your body permits. If your spine or the shoulders allow you so much, do only so much in the starting. Gradually go up. Don't try to force yourself up or get into too much of pain. Okay, these are very simple exercises what we are starting off as of now. Later in the series, we will be showing you more exercises for ankylosing spondylitis patients. Thank you.